Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Testing, Piloting, and Staging brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention, and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. Intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks. And it's important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, in practice, often steps will overlap and be revisited as teams test, pilot, and stage. Part 1 is usability testing and includes creating a usability testing plan, and then conducting usability testing, analyzing results, and making adjustments, which are covered in modules 2 and 3 in this series. Part 2 is piloting and includes determining the approach and developing a plan, covered in Module 4 in this series, the topic of this module, which is identifying and recruiting sites, before moving on to conducting the pilot and then assessing results, reviewing progress, and making adjustments. And finally, Part 3 is staging and scaling up, including developing or refining plans for the staging of the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, and then reviewing progress and benchmarks. Let's get started. Why do teams identify and recruit sites? Identifying and recruiting site participation in pilot testing helps the teams create the kinds of conditions needed to conduct effective testing. Decisions the team makes about the number of sites selected, the site selection criteria and process, will all have an impact on the results, and teams should be intentional about these decisions. Decisions will reflect various factors, including the pilot's purpose, the data and evaluation plans, potential site characteristics, as well as the site capacity and readiness to implement a pilot. And recruiting sites helps teams communicate the benefits and potential challenges of participation, as well as the expectations for being involved in the pilot. Teams need to think critically about site selection and recruitment. Let's review some of the key considerations. When thinking about the desired number of pilot sites, decisions should reflect the number of sites needed to achieve pilot goals, the number of sites that will adequately represent the target population and its diversity, for example, 1 site per geographic region, or a rural and urban setting, and the number of sites that can be adequately supported by available resources. Teams should consider appropriate selection criteria, which may include the site willingness to pilot and staff motivation, strong leadership and local implementation teams, sufficient organizational capacity to implement the selected intervention and participate in data collection, or the potential to build such capacity, and agreement with pilot site requirements. And the team will need to establish a process for selecting sites, which may be in the form of open applications, nominations, or team identification based on selection criteria. It is critical for teams to communicate the pilot testing process and expectations with potential sites during the recruitment period and during the course of the pilot. Teams should be prepared to share the potential benefits of pilot participation. Some of the benefits may actually be an incentive for sites to participate. For example, sites who are able to provide in-the-moment feedback and help further shape future implementation of the intervention. They should also communicate the potential costs and challenges associated with being a pilot site. For example, the time commitment for participation, including both the implementation of the project and the additional meetings and data collection to report their experiences. In addition, teams should clearly outline their expectations for pilot sites, including the expected activities, responsibilities, available supports, connections to other initiatives within the agency, as well as definitive timelines. For example, ongoing communication with the implementation team and a responsibility to take on full implementation after testing is complete and any adjustments are made to the process or the intervention based on testing results. It's important to note that teams will need to consider how they will integrate pilot sites into staging plans for the final intervention if there is a decision to move forward with large-scale implementation. As a team, consider the following questions to help identify and recruit sites for pilot testing. What is the number of sites needed to achieve goals, and the number of sites that can be supported with